The normal heartbeat produces two heart sounds named first and second heart sounds. First heart sound is produced when the lower chambers of the heart contract. At this time, the walls between the upper and lower chambers close, producing the first heart sound. Second heart sound is produced when the lower chambers start relaxing after a contraction. They are produced by closure of the walls between the lower chambers and the great vessels arising from them. Occasionally, a third heart sound may be heard in normal children. A fourth heart sound may be heard in elderly sometimes. Otherwise, the presence of third and fourth heart sounds are taken as abnormal. In addition to heart sounds, additional longer vibrations may be heard, which are called as heart murmurs. A heart murmur without heart disease is known as innocent heart murmur. They are most often heard in children due to the higher velocity of blood flow. Other names which may be given for innocent murmurs are physiological murmur, normal murmur, and even functional murmur. But the term innocent murmur is preferred as it strongly conveys that nothing is abnormal. Innocent heart murmurs are quite common in children. They are often detected when blood flow velocity increases with fever. Less than 1% of murmurs in children are due to birth defects of the heart. A common innocent murmur heard in children is called Still's murmur. It was described by George Frederick Still in 1909. Still's murmur is heard in the front of the chest to the left of the breastbone, sternum. Often it is a musical murmur, best heard when the child is lying down, decreasing in intensity when the child sits or stands. Another common innocent murmur is a venous hum in the neck due to the blood flow in the great veins returning blood to the heart. It disappears on light pressure over the great veins of the neck. It also changes with position and is better in the sitting position than in the lying position due to the effect of gravity. Looking down or the side may also make the venous hum inaudible. What is a heart murmur and what causes it? Very often, children are detected to have heart murmurs either during a routine visit to the doctor or from school health programs. This causes a lot of anxiety to the parents. Normally, heart produces two heart sounds, namely first and second heart sounds. An audible vibration in between the heart sounds is called a heart murmur. They are generally of longer duration than heart sounds. Many murmurs are innocent murmurs due to enhanced flow across the walls producing turbulence. In children, blood flow velocity is generally faster than in adults. Normal laminar flow of blood across the walls do not produce any murmur. Murmurs are produced by turbulent flow, usually of higher velocity. Some of the murmurs are due to abnormal blood flow, as in the case of leaky valve, obstructed valve, or abnormal communication between the chambers of the heart in the form of birth defects in its walls. Innocent murmurs are more common in children than murmurs due to significant heart disease. Though innocent murmurs and murmurs due to heart disease can be often differentiated by physical examination, an ultrasound study, echocardiogram is sometimes considered to rule out significant associated heart disease. A common cause of murmur, which is not due to heart disease, is anemia. In anemia with associated low blood levels of hemoglobin, blood flow velocity is increased, causing turbulence and murmur. Increased function of thyroid gland can also increase the blood flow velocity and cause murmur. This is associated with a fast heart rate as well, which is sometimes irregular.